To start with, let's launch the software. And in this case, it's right here. It's called the neuromap.net. It's a .net software. Let's just double click on it. Needless to say, the machine is connected to the laptop through the USB port at this point, and the software is getting started. Here we go. The software is loaded. Right then and there, to get started, you go to Exam, and you select a new exam. There you're presented with the patient info window, in which you can put as much or as little patient information that you need. Obviously, you need a minimum of patient information to get started. For instance, like the name. Let's choose Jonathan Siegel. And let's say Jonathan is a male. And here, birth date, you can enter anything you want. It's 1/1/1980, let's say. Height, let's say it's 170 centimeters. Weight, let's say it's 80 kilos. Department, you can choose whatever department you want. Neurology, physical medicine, internal medicine, whichever. Let's say internal medicine. Here we go. Diagnosis, what is this patient referred for? You can say, well, the traditional carpal tunnel. Here we go. And then you have standard diagnoses. This is for the ICD-9 codes. I just have to warn you that these things are updated all the time, so the list that you have may not be up to date. But if you do find something up to date, just choose it. In this case, it's going to be diseases of the nervous system, and we can pick diseases of peripheral nerve and carpal tunnel and so forth and so on. I just want to show you this just in case you wanted to input that. Then you can put the name of the doctor, Dr. Smith, the name of the assistant, it could be Eddie, and the nurse. You don't need to fill these things out, but for sure you need a name, you need a sex, you need height, and you need a birth date. You don't need weight. It's for your own records. But the program needs all this thing to compare to normal values if you updated normal values. Also, you can put a patient ID number. This could be something in your medical records, a social security number, whatever you use for your own system. Once you say OK, then you're going to get presented with the exam menu again. And in this, now you're going to do a test. When you do a test, you could use the pre-configured exam templates, okay? And these will have an upper nerve conduction, a lower extremity nerve conduction, right arm EMG, left arm EMG, right leg EMG, left leg EMG. Again, depends on what you want to do. Or if you don't want to use a template, you can go to Test, New, and pick a nerve out of the motor and sensory nerves that you have. Let's say you want to pick up the median motor, or the peroneal motor, or the median sensory, and it has here next to them right and left. If you want to do this, you pick the nerve that you want to pick, you click on it, and then you click OK, and then we'll select that nerve. So one thing you're going to have to decide early on is if you want to work with templates or if you want to work with nerves as you decide which one you want to do, or muscles. Let me explain briefly what a template is. Basically, let's go here under exam and say exam templates. When we send you the machine, it's going to come with preset templates for upper extremity conductions, lower extremity conductions, upper extremity EMG, lower extremity EMG. Let me explain what that means. Whenever you select, let's say, upper extremity nerve conduction studies, like so, okay, the machine is going to have preloaded in it a set of upper extremity nerves that you would want to do routinely. You can change those, but the ones that we send you are the ones that we do routinely. For instance, the first nerve that we do routinely is the median sensory on the right side. You could do it on the left side. You decide. But that's the first nerve that we do routinely. What that means is when I press the test next button, that means that the next test that we do will come up. And I just press that on the machine, and the next test that comes up is the ulnar sensory. When I'm done with this, if I press next test, I come up with the radial sensory. If I press next test, I come up with the median sensory, median motor, that is. So you get the idea, basically. And finally, if I come up with the next test, I come up with the F waves, then the ulnar motor, and then the ulnar F wave. So I think you get the idea of what we're trying to do. Now, what that means is we put these nerves in this order. We put the filters that we need to record these nerves on. We put the sweep speed, amplitude, everything. We put all the settings that we need to put these things on. And that's how the machine will record. Now, 9 times out of 10, you probably want to use these settings because you don't want to choose a new nerve each time because you do it in a routine way in this fashion. But sometimes you want to change that. So you can either change the template, that means the upper extremity nerve conduction, you might want to do just median sensory and ulnar sensory and no radial sensory. So what I'm going to show you next is how to build a template that you will use routinely. Here's how it works. You go to setup, you click on it, and you say, I want to change. Then you get into this screen here, and in this you need to click on software. When you click on software, you're presented with exam templates, test templates, and sites. Let's click on exam templates to begin with. When you click on that, you're going to be presented with the templates that we sent you. You can do one of two things here. You can say, I want to change one of those, or I want to add a completely new one of my own. Let's play with the simple ones first. Let's say you like the upper extremity nerve conductions that we sent you, but you want to add some nerves that we normally don't do. In that case, I would say change. Here you see that the exam template name that we have is called upper extremity nerve conductions. You can change that and you can say upper extremity sensory and motor studies. If you change that and you click OK, it will save it under that name. So the name will become different. But that's not a big deal. You can see below here in the test templates that what we set up for you as the upper extremity nerve conduction. And here you see that we set up for routine studies median sensory right, ulnar sensory right, radial sensory right, median motor right with F, ulnar motor right with F, and then everything else on the same side. Now let's say that you don't want to do the radial sensory routinely. You click on that and you say delete. And now whenever you go on the machine and you press test next, test next, test next, it will do median sensory, ulnar sensory, and median motor. The radial will not show up. Let's say you made a mistake and you want to put that back in. You go here on add and you click on radial sensory, which is right here. Let's see if we can find it. Under sensory CV, radial sensory right, and say OK. So you see now the radial sensory came back. So you can add it or change it. But let's say that you agree with us and you want to have a median sensory, ulnar sensory, and radial sensory. Let's choose the median sensory palmar right. So you can add this and say OK. And now you see you have the median sensory right, ulnar sensory right, median sensory palmar on the sensory CV. It's above the radial. If you don't like it to be above, if you want it to be below the radial or above the ulnar sensory, so you do the median at both times, you just click this button up here. It goes up here. So now each time I press test next, you're going to have median sensory right, median sensory palmar right, and then ulnar sensory, and then radial sensory. So you get the idea. Here I change this. And I could do that for the left and the right. I could add a new nerve that is not there. I could take out a nerve that I don't want to be there, and vice versa. And now I click OK. So now when you go to the machine, every time you click upper NCV, it's going to give you, in addition to what we have set up, the median sensory palmar. You could do the same thing for the right arm EMG, for instance. Let's go there and say change. Click on change here. Okay. And you can say, well, I don't want to do the deltoid all the time. So I click on that and I say delete. And now if you press OK, it's not going to show you the deltoid. On the other hand, you know, I changed my mind. No, I really do want to do the deltoid. So I go here and I find out under electromyography, of course, because I'm doing needle exam, interference pattern. I want to add the deltoid on the right. Okay, so I click on that and I click OK. Now the deltoid showed up again. But let's say that you already want to do all of these things, but you want to add some new muscles on a routine basis, because this is routine here. I say add, and I go to electromyography, because interference pattern, because that's what we're doing. And, you know, I want to add the, for instance, the vastus lateralis or whatever, flexor carpi radialis on the left side every time I do that. So I click OK, and now it added it. And that will become part of the routine things that I do when I do an upper extremity. You might want to add another muscle, of course, but I'm just showing you how you add or subtract. Now that we've done this, if you click OK, every time you load these things, when you press test next, test next, test next, it's going to show you these muscles in that order. I'm not going to click OK because I like these setups. So I'm going to click cancel. But if you click OK, it will save it. So in this case, I'm going to click cancel. Now let's say that you don't like any of these things that we've done, which I find very surprising. But let's say that you don't. You can click on exam templates here and say, I want to add one. And I want to add one that I'm going to call my template. Here we go. Now, or I'm going to say this is going to be Dr. Smith's template, so that she doesn't take your template, you don't take her template. Okay? This way, each time this comes up, let's call it here Smith's template to make it even easier. Here we go. So now, in this window, I can add all of the nerves, all the muscles that I want to do, that Dr. Smith wants to do routinely. So I click Add, and again, I come to the set of nerves and muscles in the upper extremity. So let's say in the motor NCV, Dr. Smith wants to do the median motor right. Okay, I click on that. You see the median motor right comes up. She next wants to do the ulnar motor right. Click on that, say OK. And next she wants to do the peroneal motor right. Click OK. And next she wants to do the tibial motor right, and click OK. All right. So now if I click OK here, you see I got Smith template. So whenever we get this thing opened up and I go to exam template, and I say load, I click on that, I have a window that is going to show me Smith template. When I double click on that, it's going to pull Dr. Smith's template, and it's going to do all the nerves that she chose in the order that she chose. And then I say OK. And I say OK. And now I changed all of these things. Now, having done all this, one last thing you need to do before you close is to say save, and I'm gonna save this file name here. Okay, and let's make a place where we want to save them. I usually like to save them in focus setup files here, so this way I know that this is where I put these setup files. So I call it new Dr. Smith template. You can call it anything you want, or you can call it, you know, May 25 template to indicate what time you did it. But when you do this and you click save, it's going to save it. Right? Now, If you want to work with this template, the next thing you need to do whenever you start a new patient is to say load, setup, load, and you click on new Dr. Smith template and say open. Now look what happens next. Settings copying is finished. Okay. Now I go to exam template. Look, I have Smith template. Right? And now look what happens when I click next and next and next, test next. So median motor, then it's going to give me the ulnar motor, then it's going to give me the peroneal motor, and then it's going to give me the tibial motor. And that's what you did actually. So that's how you set up a new template or change a template that we have sent you and add some muscles or nerves or take away some muscles and nerves. So let's say now that you do want to change a template or create a new one, but you can't find the nerve that you want to add to this template. And you want to create that nerve to add it to the template. Here's what you do. You again go to Setup, Change, and Software. Once you get there, don't choose exam templates. Now you want to choose test templates because we're changing a test or we're adding a test. Here we go. Again, you get to this menu, and here we are doing the nerve conductions, and let's say the sensory for the sake of argument. That now, let me take this out here. I'm going to delete this and add it, show you how we add it again. Okay, so now let's say that you want to add the lateral antebrachial, and we don't have it in the list of nerves that we have provided you with. Let's say you want to add something similar to the medial antebrachial, but not the same. You want to add the lateral antebrachial. The best way to find all of the nerves and muscles to record from is click on a nerve that's similar to it. In this case, it's going to be the medial antebrachial. And do not click change here because that will change that nerve. You want to add a nerve, right? So you click on that one and you say, I want a new test template. Here we go. So now it shows me that this is a medial antebrachial. All I'm going to do is I'm going to click on medial, and instead of that, enter lateral. And here I say I want it on channel 1. Then I click next. And it's giving me the choice. Where do I get it from? Do I get it from the forearm? Here are the choices. Do I get it from the head and neck? And let's say here. Let's pick something that has something in it. You see, when you click hand or when you click, forearm, it gives you a choice or choices of what nerves you can record from. So in this case, it's going to be forearm in the front. And the forearm in the front, you have two nerves that you could choose to record from. Of course, we're going to choose the lateral cutaneous antebrachial, gives you C5-6. And you can name it that way, or you can change the name. It gives you an option to name it something else. You can put C6-7 if you believe C5-6 is inaccurate, but let's not do that right now. So I say that's what I want to record from, and I want to record it from the right. And then I say next. And there's no additional montages here. I click on that. Leave these alone right now. Don't touch them. So I say next. Next. And acquisition with single stimulation. We're not going to do repetitive stimulation. Acquisition completion. All of these are routines. You don't have to worry about those. And then it gives you the signal input range 1 millivolts. You can change the low frequency if you want to settings that you want. This is where you change it from, or the high frequencies. The notch filter adapter, the sampling rate. I would leave those alone if you're happy with those. Those are routine setups. Then I click next. And sound output is going to be on channel 1, which is what I use for recordings. And then I would leave those alone again because it's not going to change anything in what you do. And sensory CV. And it's going to measure here the nerve actual potential onset, the nerve peak, latency, the negative peak end, and so forth and so on. You can choose where you want to measure from, the onset or the peak. And I click next. And that's it. I click OK. So now you see here that I added a lateral antibrachial right, which wasn't there in the first place. Now, of course, I might want to add a lateral antibrachial left. So I say new test template. Don't click change, because if you change, you're going to change this one. I want to create a new one. And in this case, I click new test template. And instead of lateral antibrachial right, I say I want to do the left. Now guess what? You did all of the hard work before. So all you have to do here is click next. And instead of clicking right, you click left. Right there. And then you click OK. And now we created a lateral antibrachial left. Now if you want the right above the left, all you got to do is do this and click up. And as soon as I get it right here, and the right is going to be above the left, and that's how you do that. And you click OK again. And you click OK. And don't forget to save the setup after you're done. When you click save, it's going to give you the option to save it. You can name it anything you want. And next time you want to do this, I'm going to cancel because it's already saved. Next time you want to do that, if you load this, it will show you these nerves as you loaded them, added them, or deleted them. Now let's say that you don't want to work with templates at all. You just want to do one nerve at a time. That's an easy one. Here you go. You go to test and new, right there. And here, if you're doing nerve conductions, let's say motor nerve conductions, you click on that. Let's say that this is closed. You click on that and open it. You click on motor. And you choose any of these motor nerves that we've set up for you. Let's say that you choose the median motor right. You say OK. You're presented with the median motor right. Notice that if you click test next here on the machine, it's not going to go anywhere because there's no template for this. You're just doing one nerve at a time. Let's say you just want to do the median motor and median sensory. That's all you want to do. Now you chose the median motor right. And now you go to next. Now you want to do the sensory right. So you click median sensory right and say OK. And the median sensory right appears. You do the study, and that's your study. So you can go one nerve at a time or one muscle at a time. Let's say you want to go to EMG next. You go to next, new, and you click on electromyography right there, and interference pattern, and you say I want to do the first dorsal interosseous right. Say OK. That comes up. And then you want to do next test. Let's say new test here. And you want to do the brachioradialis on the left, let's say. That comes up right there. And that's your test. So you don't need to go through a template. We could choose as little and as few and as many muscles as you want when you're doing this. Now let's say that you don't like this view of the median motor or the ulnar motor, and you don't like to see these, or you want to see more of these, or you want to see less of those. This is going to be changed in view. So basically look at this here. When I select view, it gives you analysis table, and here I'm saying show me the M-wave parameters, okay, and show me the motor CV. Okay, these are the parameters right here at the bottom, and the motor CV, you can see it right above it. So let's say I'm going to hide all, okay? Now it's only showing you the analysis graphs, okay? The M-wave amplitude, the M-wave area, the motor CV, the M-wave latency, okay? It's only going to show you your patient data compared to your normal values, the normal values that you inputted or that you uploaded. So here, if this is showing me the M-wave amplitude and the motor CV. So if I click on this, it's going to show me the area. If I click on this, it's going to show me the latency. Okay. So here, let's click on view from this end here. And I say analysis graphs. And I can hide all of these. So now all you see is just the full screen. And let's bring it back. That's not good looking. I say show all. So here we go back to this screen, and latency and amplitude and area and so forth and so on. And let's go back to the analysis table. And let's say I want to see the M-wave parameters. Okay, it's showing me here stimulation point, distance, latency, amplitude, duration, area, stim, and those you don't have to have them all. You can go again to setup, change, nerve conductions, and the default template for sensory or motor. You could choose which one you want to see. You might not want to see the duration or the area, so you can choose that, and then you have to save and load the new setting. And now let's go to analysis tables and say, well, I want to see the conduction velocity as well. Here we go. And so it's going to show you these and those. And that's how you can change the view. That's fairly simple. And again, once you have done that, you're going to go to setup, save, give it a new name, and load it, and then it will implement that essentially. Let's say that now you want to do the needle exam. Again, you go to exam, and let's pick a template for the time being. Make it simple. Click on exam, and exam template, and let's say right arm EMG. It's going to load the first muscle that we choose for doing right arm EMG in our template. In this case, it's the first dorsal interosseous on the right side. You're presented with that screen, and that screen is going to tell you that you're doing on the right side first dorsal interosseous. It's ulnar innervated C8T1 muscle. And then down here, you see that it tells you what you're studying, whether you can put the information here, whether the spontaneous activity is normal or abnormal, whether the MUP amplitude, the motor unit potential amplitude is normal or abnormal, the duration, so forth and so on, and the polyphysicity, whether it's normal or abnormal. I'll tell you about this in a minute. But basically, this is where when you input this information, this is how you build your report, because that's where it's going to go from this to your report. Once you have that screen, now you stick the needle in the muscle and you ask the subject to activate the muscle, and I'll show you what it looks like in a minute. And then you can acquire and save the potentials, copy them, paste them, do a lot of stuff. But basically, you just do a routine needle exam. Once you're done with this, you press test next. And in the case of the upper extremity, the next muscle that we do is the flexor carpi radialis. And again, you measure you study the motor unit potential, measure the duration, amplitude, latency, so forth and so on. And you fill in the information here below so that it goes to your report. Also on this side, you get an instantaneous analysis of the turns and amplitude of your signal and of the spectral analysis of your signal as well. Again, then you press next, and then test next, and test next. It's going to take you to all of the muscles that are in that template. Same thing for the lower extremity, exactly in the same order. Once you're done with that, you can go to the report, or you can finish the exam and take it up some other time, continue it. So basically, that's the needle exam and the upper extremity. Lower extremity essentially follows the same principle. Let's go over the screen. First of all, this is the screen that shows you where the motor unit potential is going to be displayed. Here you can set up the sweep speed that you want to use. I usually use 10 milliseconds per division. And let's set up, for instance, the gain that you want to use. I usually use anywhere between 150 or 200. Let's say 200 at this point. So this is a screen that's going to display this right now, as you can see. And it's going to tell you you're doing the right first dorsal interosseous muscle. It's ulnar innervated and C8T1. It shows you the filters that you'll be using, 20 hertz for the low filters. High frequency is 10 kilohertz, and so on and so forth. So right here below that is what you will input as you're doing the needle exam to be printed out in the report. So here I have spontaneous activity, obviously the site name, spontaneous activity. I have it as normal or abnormal. You can choose either one. Motor unit amplitude, duration, and polyphysicity. We can change all of that. And right here you have a spectral analysis and a turns and amplitude analysis, which tells you whether or not the motor units that you're testing are normal. So let's take an example, for instance. Let's press the acquire button here. I have a needle in a patient, and here we go. Now you're going to see this display here, and I'm going to put it at 10 millisecond per division because that's what I'm used to, and about 150 microvolt. You can set up in the default template to give you 10 millisecond and 100 microvolt every time you select this. All right, so let's say we selected those. Now have the patient activate the muscle. Here we go. And you're going to see the motor units here. Patient is activating the muscle. Then I acquire, which is going to give me a different screen here. Now I'm acquiring. Okay, then I stop acquisition. I say that's what I want. And look what happened here. You see that this gave you a turns and amplitude analysis of the motor unit potentials that I acquired a minute ago. Usually they fall in this square here from 1000 to 500. Anything within this square is going to be within normal limits. It changes from muscle to muscle, obviously, but generally speaking, you're going to be in this area. Anything above that is going to have a high amplitude and polyphasic potentials. Anything in this low end of the square is going to be maybe polyphasic but low amplitude. So things are above, if things are above, they're going to be called neurogenic. If things are below, they're going to be called myopathic, generally speaking. Now let's say that you don't like to have spontaneous activity, normal, abnormal, amplitude, duration, polyphasicity, and you want to change that. And here's how you do to change that. Okay, so we said, let's say that you don't like normal, abnormal, you want to put some 1 plus, 2 plus, 3 plus, whatever, change MUP duration and polyphasicity and so forth and so on. All you got to do right now is gonna go to change again. So go to setup. Let's get to setup and let's click on change. All right. Again, when you click on change, go to software, and we're doing a test here, not a template. So let's go to the tests template as opposed to exam template. All right. In this case, you want to go with an EMG. Obviously, you want to go to electromyography and interference pattern. Now here I advise you to mostly work with the default template because that's the thing that everything else is generated from. Obviously the things here we already pre-set up, so if you're happy with them, leave them. If you don't like them, you can change them. But if everything is working, just leave it alone. Just play with the test template, essentially. The default template, that is. And let's click change. So once we click change here, we primarily want to change the traces display, okay, because we want to change the display right here. We don't want to change too many other things. So let's click on that. So the monitoring, it says we're monitoring at 50 milliseconds. As I said, I like to work with 10 milliseconds and 200 microvolts. So let's choose this, 10 milliseconds and 200 microvolts already preset. And that's going to be everything like this every time you load a new template. Or a new test template. Okay, I like that one. Now I go here next. And here, this is where you have the display. You see here is showing you that we have, let's move this and that. Well, it's not going to let me move this now. But at any rate, see here, spontaneous activity, MUP amplitude. It's because I chose these. Okay. Now, here you don't like normal, abnormal. All right, so let's delete it. And let's say I'm going to add spontaneous activity 1 plus. I want to make it 1 plus, 2 plus, 3 plus, 4 plus, you get the idea. Here we go, 2 plus, and add 3 plus, okay? And the same thing for MUP amplitude. You don't like to have normal versus abnormal. Some people do. Let's delete that and let's add increased versus decreased. Let's say inc, okay? And then add decreased, okay? You can spell it out also. But now you don't very much like increase, decrease. You're not quantify that. So let's say add. I want to say increase 1 plus. Okay. I want to say also increase 2 plus. Or increase 3 plus. I want to modify it. Oh, I was too fast here. Increase 3 plus. Another typo. Here we go. But look what happened now. You put it in the wrong order because it should be above decrease here. So we'll just move decrease down. Down, down, down. And you can also say, I want to decrease 1 plus, decrease 2 plus, add. You get the idea. Motor unit duration. You can do exactly the same thing. Motor unit polyphasicity. Increase 1 plus, 2 plus, 3 plus, decrease, whatever. And then you can add pattern. Pattern is, low activation or high or increased activation or complex or simple, whatever you want to call it, just add it and you do that. And frequency, you can add frequency, and you can add comments here also. You can say, well, this is neurogenic, this is myopathic, and so forth and so on. So now you show that, and the next thing you're going to do is you're going to go and say, well, I need to save this right now, right? Okay. So basically, go next. And test protocol, active protocol, doesn't matter. Next. Next. And now, what is this? This is going to be in traces view. Okay, this is how you're going to see your traces. So basically, after finishing that, you set, and we're going to click traces view and all except sites. Basically, it's going to change these things in every single muscle that you do. Okay, and we're going to click OK. 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 And what is it that we have not done? Now we're going to save this setting. Once we save it, let's call it a new setup and call it save. And it already tells me it already exists. I'm going to overwrite it because I've written it before. Now I have to load this setup that I saved. Here it is. I'm going to open it, and it has to load it. Once it loads it, it tells me the settings copying is finished. Okay. And now the next muscle that I select is going to be the brachioradialis. The other two, the first two, I had not selected those. Look, now it's going to show me normal 1 plus, 2 plus, 3 plus. Same thing here, increase 1 plus, 2 plus, 3 plus. It's going to show me all of these things right now. Everything that I change is going to appear in that. So because in the first two I had not implemented it, obviously it doesn't show me that. But now if you close this and reopen it, every single muscle that you're going to do is going to show you the changes that you've seen before, that you have implemented before. And that's how it is. Now I want to cover the exam inspector. Let's say you've done a test before and you want to reload that test and continue it, essentially. So here, you see view here. I click on view and I say I want to see the exam inspector. Now it's showing me the test of the patient that I'm doing. Okay, right here. But let's say I want to pick a patient that I had done before. Let's say I want to pick this one here, Joy. I'll open that. And now the exam inspector is going to show me both the test that I'm doing and the test that also I have done in the past on Joy. And here in this case I have the median sensory. So you can see the median sensory here, and you can see all of the information on that nerve. And I can add a nerve now, I can delete a nerve, and so forth and so on. And I can do anything I want. So that's how I load patients that I had done in the past. Now notice here, when you click on, right-click on that nerve here, okay, you can remove the stimulus artifact. This is the stimulus artifact. Look what happens here. Do this. Now it got rid of the stimulus artifact. Now undo removing of stimulus artifact, come back here. So you can check it and uncheck it essentially. I like very much this feature. You can comment on this trace. You can hide the trace or delete it. I'm not going to do that. You can mark for overwrite so that you can do a test over it. You can copy this particular waveform to the report, and you can put it, you can say, I want to copy this part of the waveform to the report, or this part of the waveform, which means nothing essentially. But I'm just going to show you that you can do this and copy to report, and that will copy this, exactly what you highlighted to report. Now let's say that, never mind this, that you found no response. Let's claim that this is not a response, this is artifact. It's not true, it is a response, it's not artifact. But you see, all of these things are showing this. So let's say that if you essentially get a flat line here, okay, let's say that if you essentially get a flat line, and you want to say this is 0, okay, you grab cursor 1 and you drag it all the way to the end. Okay, now notice what happens. It's going to show you that the response has a 0 amplitude. Okay, and that tells you that the response is absent versus not done. Very important. Absent means something, not done means something else.